Hi, in this tutorial I'm going to talk about segments and intervals on the ECG trace. And I'm going to talk about the diseases associated with changes in the segments and intervals. So first of all, I'm going to draw up a standard ECG trace. This trace is typical of lead 2. Now I'll label the waves. And now I'm going to split the ECG up into its segments and intervals. This is the PR segment. This is the ST segment. And between them is the QRS complex. Down here we have the PR interval and the QT interval. So let's talk about each of these divisions. The PR segment is the segment between the end of the P wave and the beginning of the Q wave. It corresponds to the time the wave of depolarization takes to travel through the AV node and into the bundle of His. There aren't many common diseases associated with the PR segment, so we'll move right along. A normal QRS complex should be less than 0.12 seconds in duration. It's associated with ventricular depolarization. If the QRS complex is longer than 0.12 seconds, we call this QRS widening, and it usually suggests a ventricular escape rhythm, which is a rhythm that originates within the ventricles rather than the SA node, or it suggests a bundle branch block. The ST segment is really important in emergency medicine because characteristic changes are often seen during a heart attack or angina. The ST segment can be normal or it can be elevated, which means it sits above the baseline on the ECG. Or it can be depressed, which means it sits below the baseline. Elevation suggests a STEMI, which stands for ST elevated myocardial infarction, also known as a heart attack. ST segment depression suggests ischemia, which usually presents as chest pain or angina. Now the PR interval should be between 0.12 and 0.2 seconds long. It corresponds to the wave of depolarization traveling from the SA node to the AV node. An increase in length could be the result of a heart block. A decrease in length could suggest Wolff-Parkinson-White syndrome. Now, the QT interval is the most complicated of all the divisions because its duration varies with heart rate. So to correct for that, we calculate the QTC. The C stands for corrected. The formula is the duration of the QT interval divided by the square root of the RR interval. The RR interval is not labelled here, but it is the duration between one R wave and the following R wave. A normal QTC should be calculated at between 0.38 and 0.42 seconds. The QT interval corresponds to the depolarization and repolarization of the ventricles. An increase in the QTC predisposes the patient to an increased risk of life-threatening ventricular tachyarrhythmias such as ventricular tachycardia, ventricular fibrillation, and torsade de pointe. And that's an overview of segments, intervals, and their associated diseases. For more free tutorials, and the PDF of this tutorial, visit www.handwrittentutorials.com.